Hello everyone, myself Dr. Rachita Bhaikar. Today in this session we are going to study about the human anatomy of kidneys. The urinary system, it consists of a pair of kidneys, the ureters, urinary bladder and the urethra. The kidneys produce the urine and the ureters convey it to the urinary bladder for the temporary storage. Finally, the urine is evacuated through the urethra. In females, the urethra is smaller or short, whereas in males it is longer, and it is a part of the urinary system as well as the reproductive system. The objectives of today's session are, by the end of the session, you will be able to tell the external features, relations, coverings, internal structure, blood supply, lymphatic drainage and applied anatomy of kidney. In introduction, I always tell you about this 4S, that is synonym, situation, shape and size. The synonyms for the kidney are the renis and the nephros. These two words are used, that's why the renal vein, rhinitis, renal fascia, renal stone, these words are used. And also we use the words such as nephron, nephritis, because nephros is also a synonym for the kidney. The kidneys are a pair of essential excretory organs which are present in the posterior abdominal wall, retroperitoneally, means behind the peritoneum, on the sides of the vertebral column, and it extends from T12 vertebra level to the L3, that is the third lumbar vertebra. The right kidney is slightly lower than the left due to the presence of the liver. The shape of the kidney, it is bean shaped with the hilum directed on the medial side. Average measurement of each kidney is 12 into 6 into 3 centimeters, length into breadth into thickness. The weight of adult male kidney is about 150 to 170 grams and in adult female is 130 to 150 grams. As in this diagram you can see the external features very well, in which they shows there are the two poles, the upper pole, the lower pole, two surfaces. This is the anterior surface and this diagram is showing the posterior surface of the kidney. Then there are the two borders. This is the lateral border and this is the medial border. Then there are two axes. This is the longitudinal axis and one is the transverse axis, and this is the hilum. So these are the external features of the kidney. Firstly, coming about the poles. The upper pole is broad and is in close contact with the suprarenal gland. Whereas you can see here the lower poles are pointed. If we see the surfaces, the anterior surface is usually showing the lobulated appearance, whereas the posterior surface is usually flat because of the presence of the muscles of posterior abdominal wall. As there are two borders, the lateral border, here you can see it is convex and the medial border is concave with the hilum in between. The kidney is having two axes, the longitudinal axis and the transverse axis. The long axis of the kidney is directed downwards and laterally, in such a way that the upper end is nearer the vertebral column than the lower end. The transverse axis is directed laterally and backwards because the kidney rests on the sloping paravertebral gutter of muscles. In the next slide, we will see the hilum of the kidney. The transpyloric plane passes through the upper part of the hilum of the right kidney and through the lower part of the hilum of the left kidney. The structures at the hilum of the kidney from anterior to posterior are the renal vein, then the renal artery, and the posteriormost structure is the renal pelvis, which continues as the ureter. Thus, this helps us in determining the side of the kidney. Always keep in mind that the ureter is going in the downward direction. Hold the kidney in such a way that this is the upper pole, this is the lower pole, this is the anterior surface, and the back one is the posterior surface, which is a flatter surface, as well as the structure at the hilum are from anterior to posterior. Firstly, there should be the renal vein, which is having less thickness of the wall. Then there will be the renal artery, and lastly there will be the pelvis, which will be continuing with that of the ureter. In that way you are going to identify the side of the kidney. Relations of the kidney. Firstly, the anterior relations of the kidney. The anterior surface is convex and directed forward and laterally, and it is partly covered by the peritoneum. Relations of anterior surface of both the kidneys, that is right kidney as well as left kidney, differs because of its position. The right kidney presents the following 5 areas. First area, from above downwards if we see, it is the suprarenal area, which is a non-peritoneal area on the upper pole and slightly on the medial side of the kidney it is present, and it is overlapped by means of the adrenal gland, that is the suprarenal gland. Next comes the duodenal area. This duodenal area is a non-peritoneal area. It passes along the medial border in front of the hilum and is related with the second part of the duodenum. Then comes the hepatic area. It is a peritoneal area, includes the upper 3/4 of the anterior surface related to the right lobe of liver, and it is separated by means of hepatorenal pouch of Morrison. This can be asked as an MCQ for you, that is hepatorenal pouch of Morrison. It is in relation with. The fourth area is the colic area. This is non-peritoneal, occupies the lateral part of the lower pole and related to the right colic flexure. The last area which is here, which is not shown in this diagram, is the jejunal area. It is a small peritoneal area, occupies the medial part of the lower pole and related with few coils of the jejunum. So the 5 relations on the right side of the kidney are the suprarenal area, the duodenal area, the hepatic area, the colic area, and here will be the jejunal area. Whereas on the left side, there are the 6 areas which are in relation to the left kidney. Firstly, seeing the suprarenal area. The suprarenal area is the non-peritoneal area and it occupies the upper part of the medial border and the adjoining upper pole of the kidney, and it is overlapped by means of the left adrenal gland. This is the splenic area. It is a peritoneal area, occupies the upper 2/3 of the lateral border and adjoining anterior surface and related to the renal impression of the spleen. The third area is the gastric area. It forms a triangular peritoneal area which intervenes between the suprarenal and splenic area. And this is in relation with the posterior surface of stomach. Below this is the pancreatic area. It is a non-peritoneal slip across the hilum of the kidney and is related to the body of the pancreas and the splenic vessels. Then again, the lower part of the kidney are same for both right and left. Here on the medial side is in relation with the coils of the jejunum, and on the lateral side it is in relation with the colon, that is the left flexure of the colon. So right kidney with the right flexure of colon and left kidney with the left flexure of the colon. Now on the posterior relations of the kidney, firstly the posterior surface, as we have seen, it is a flat surface because of the presence of the muscles which are on the posterior abdominal wall. And this posterior surface is directed backwards and medially and is entirely non-peritoneal. The posterior surface presents two parts, that is the upper part and the lower part. The upper part is in relation with the diaphragm as well as the ribs, whereas the lower part, it is in relation with muscles, vessels and the nerves. As we have seen, the right kidney is slightly lower as compared to the left kidney. So that's why the right side kidney is only in relation with one rib, that is the 12th rib. Whereas the left kidney, it is higher up, so that's why it is in relation with the 11th rib as well as the 12th rib. The lower part of the posterior surface is in relation from lateral to medial side. The muscles are the transversus abdominis, the quadratus lumborum, and this is the psoas major muscle. Whereas the vessels in which we are related is this vessel, that is the subcostal vessels and nerves, which are in relation with the diaphragm. The nerves which are in relation with the posterior surface are the subcostal nerve, the iliohypogastric nerve, and the ilioinguinal nerve from above downwards. Just to revise the peritoneal relations of the kidney, in the right kidney we have seen that there are the two areas which are peritoneally covered, that is the hepatic area, and here was the jejunal area which was covered by means of the peritoneum. Whereas on the left kidney, there are the three areas which are covered by means of the peritoneum, and these areas are, this was the triangular area which is the gastric area, this is the splenic area, and this area again the same one, that is the jejunal area. So two areas are peritoneal on the right side, whereas three areas are peritoneal on the left side. The coverings of the kidney from within outwards are four layers. One is the fibrous capsule, also called as the true capsule. Then comes the perinephric fat area, okay, which is also called as the adipose capsule. The third layer is the renal fascia, which is also called as the false capsule. This is also called as the Girota's fascia. And lastly, this one, the yellow one, which is on the outer side, is called as the paranephric fat. This was the transverse section showing us all the coverings or the capsules of the kidney.